Good day, Ma'am Dal. I hope you're doing good today. My name is Kenneth D. Velasquez from Section 12A, Group 24, and a student nurse from Davao Doctors College. Today, I will be showing you, ma'am, my return demonstration in performing perineal flushing. This is a hygienic care that involves cleaning the perineum and the genitalia. This procedure is important for us to remove normal perineal secretions and others, to promote clients' comfort, and of course to prevent infection or contamination from the rectum. So first, we need to prepare all the needed materials for us to save time and effort. So the materials that we are going to use are gloves, bath blankets, rubber sheets, bedpan, warm water, sterile warm water, 7 pieces dry cotton balls, 7 pieces cotton balls soaked in cleansing solution, extra cotton balls for the buttocks, kidney basin, pickup forceps, and lastly, antiseptic spray and perineal pad, but only as needed. Of course, completeness and organization of our equipment ensures our efficiency as nurses. And now that we are all set, we can now proceed performing hand washing for us to deter the spread of microorganisms. After that, prior to performing the procedure, we need to introduce yourself and verify the client's identity using agency protocol, explain the treatment to the patients and why it's necessary for us to let the patient understand the procedure and gain the patient's cooperation as well. Good day, ma'am. My name is Kenneth D. Velasquez, your student nurse from Davao Doctors College, and by the way, you can call me Ken. Before we start, may I see your wristband, please? Can you please tell me your full name, ma'am?
Justin Velasquez,
How about your birth date, ma'am?
November 10.
Then, what would you like me to call you, ma'am?
Justin Velasquez,
That's nice to hear, ma'am. That's nice to hear, Justine. How's your day going so far?
it's good.
That's nice to hear, and I really hope that our day will end up a good one. Of course, Mom Justine, I want you to be informed that I will be conducting an assessment called perineal flushing for you today. And of course, I want you to be informed that your perineal area or your private area will be exposed. Is that okay with you?
Yes,
Do you have any other questions? Of course, ma'am, upon exposure, I will be cleaning your perineal area for us to avoid or prevent any contamination or infection from any perineal odor or secretions, okay? Before I proceed, do you have any other questions? Okay. So after, we will be screening the patients or locking the door of the patient's room. This is important for us to provide privacy. And of course, I will be locking the door, ma'am, okay?
yes,
I'll also screen this one. And after, we will be wearing our gloves for infection control. So now we need to position the patient on a dorsal recondense position, and this is a back lying position with the knees flexed and spread well apart. That of course will give comfort to our patients. Good day, ma'am. Can you please flex your knees for me? Mhm. Are you comfortable?
yes,
How about the temperature, ma'am? Are you okay with the temperature?
yes,
I see. Of course, next we will be covering her body and legs with bath blankets and place the rubber sheets with the bedpan on top under the patient's buttocks. Okay, Ma'am Justine, we are now starting with the procedure. Okay, so I want you to be informed that I will be removing now your top sheet, okay? Just flex your knees for me, ma'am. And this top sheet will be placed on a medical hamper. Okay, Ma'am Justine. Is it okay if you face there, ma'am, at your opposite side? Then face here with me, ma'am. Then go there. Just let me know, ma'am, if you have any questions or concerns, okay? Can you please flex your knees for me? Flex your knees. And now I will be placing the bedpan, okay? I see. Now, I will be placing this bath blanket. Just let me know, ma'am, if you are chilling or freezing or the like, okay? Okay, so here, as you can see, the rubber sheets that I have just put prevents the bed from becoming soiled, while the bedpan, this one, is used if the patient is in need in passing of urine or stool and secures the excess water upon flushing. Of course, next we need to drape the patient, exposing only the parts to be cleansed, because minimum exposure lessens the embarrassments and helps to provide warmth for the patients. Okay, ma'am, I will be exposing your private area, okay? So just to clarify here, please expose only the parts to be cleansed. Cover her feet to prevent from any chilling, or are you okay? Okay, just let me know, ma'am, if you're chilling, okay? Just steady here. Steady. That's it. And now we will be inspecting the perineum and note areas of inflammation, swelling, excessive discharge, or secretion from the orifice, and any presence of odor. And upon inspection, I think that there are no any abnormalities at all. There are no any odors, and there are no any abnormalities that I have aforementioned a while ago. So after, we will be flushing the perineal area with warm water to prevent chilling and soften or dissolve blood clots. And of course, this is our warm water. And Ma'am Justine, I will be pouring a warm water to your private area, and just to make sure that you're comfortable with the water, can you please test it? Are you okay with this one? Okay, so I will be pouring the water now, ma'am, okay? How do that feel, ma'am? It's good, okay. That's nice to hear. So now we will be getting a cotton ball soaked in a cleansing solution using pick-up forceps to, of course, to maintain sterility. And as you can see, this is 7 pieces cotton ball soaked in a cleansing solution. So using this cotton ball, we need to clean the external genitalia, starting from the midline of symphysis pubis down to the anus, but always remember to never retrace a stroke to prevent contamination of the area. Therefore, discard each cotton to receptacle every after application. Okay, ma'am, I'm starting the assessment now, okay? Just let me know if you're not comfortable, okay? Starting from the mons pubis down to the midline of the symphysis pubis down to the anus, then discard, then get another cotton ball immediately, and with this second cotton ball, clean starting from the mons pubis in figure of 7 by way of internal labium towards the anus, and discard after. We need to take note that secretions that tend to collect around the labia minora facilitate bacterial growth. And of course, from the mons pubis in figure of 7 down to the labia minora, down to the anus, and discard and get another cotton ball soaked in a cleansing solution, and do this likewise on the opposite side using the next cotton ball in a figure of 7, of course. Mons pubis, figure of 7, down to the labia minora, down to the anus, then discard. And of course, get another cotton ball. And with the fourth cotton ball, we will be cleaning starting from the mons pubis in figure of 7 by way of external labium towards the anus, then discard after. Just a quick recap. The word labia majora is also defined as the larger lips or the external parts of the perineal area. So from the mons pubis in figure of 7 down to the labia majora down to the anus, then discard. So next is we will be doing this likewise on the opposite side. We will be doing this likewise on the opposite side using the next cotton ball and a figure of 7, of course. Mons pubis down to a figure of 7 down to the labia majora down to the anus, then discard. So with another cotton ball, we need to clean the groin, starting from the groin, of course, going up with the thigh using a zigzag pattern. And using a zigzag pattern will help us to prevent retracing a stroke. Okay, ma'am, I'm starting with the groin part. Starting from the groin down up to the thigh, include it here, and then place it in the receptacle and get another cotton. And of course, you can also use the other side of the cotton ball for the near groin. But for us to avoid possible contamination, we can use the 7th cotton ball that was soaked in a cleansing solution. So from the groin up to the thigh of the left parts of the patient. Okay, ma'am, are you comfortable? I see. So after, we will be flushing the perineum thoroughly with sterile warm water to reduce the possible transmission of microorganisms. So as you can see here, I labeled it here as sterile warm water. Okay, ma'am, I will be pouring again a water. Are you okay with this? How does that feel, ma'am? It's good. It's nice to hear, ma'am. You're really cooperative. And next, using the 7 dry cotton balls, we need to dry the perineum, applying the same sequence of stroke just like what I have done a while ago. Of course, drying is important because moisture supports the growth of many microorganisms. So as you can see, this is dry cotton balls. I labeled it here. Then we will be starting from the mons pubis down to the midline of the symphysis pubis down to the anus. Discard in the receptacle. Then mons pubis in a figure of 7 down to the labia minora down to the anus. Then discard in the receptacle. Then go to the opposite side. Then discard. Then another cotton ball. Mons pubis, figure of 7, labia majora to the anus. Then another cotton ball for the opposite side. The mons pubis, figure of 7, labia majora down to the anus. And of course, we will be proceeding in the groin part. Are you okay, ma'am? Do you not feel ticklish at all? Are you comfortable? Then the last part, this is the 7th cotton ball, the dry cotton ball, from the groin up to the thigh. And of course, after, we will be removing the bad band gently and turn the patient to the side. Okay, I will be removing the bad band now. Ma'am, I would like to request, would you like to move your body to the side, please? Okay. And of course, here, if necessary, take 1 cotton ball and clean one side of the buttocks using a zigzag pattern. Cleaning the buttocks also provide comfort to the patient. Using this pickup forceps, go get another cotton ball soaked in a cleansing solution. And then, Mom Justine, I would like to let you know that I'm cleaning your buttocks part, okay? Do you have any other issues about this one? Okay, I will be exposing this one, okay? zigzag pattern for us to prevent retracing a stroke, because retracing a stroke again will increase the risk of contamination. Then clean on the other side of the buttocks using another cotton to prevent the spread of microorganisms. So after, dry both buttocks using dry cotton balls to avoid moisture that support the growth of many microorganisms. In your buttocks part, Ma'am Justine, do you not feel ticklish at all? I see. It's nice to hear, Ma'am. I would like you to let you know that the procedure is almost done, okay? Just let me go back here. So after, we need to turn the patient on her back and make her comfortable enough for us to promote relaxation. Just bring back to your old position, ma'am. Okay. So we also need to spray with an antiseptic as needed to promote healing. And of course, Ma'am Justine, can you please go back or flexing your knees for me? Just let me know, ma'am, if you're chilling, okay? Because I feel that it's already chilling. Are you not chilling enough? I see. Just let me know, ma'am. So this is a antiseptic spray. This is for your perineal area. Do you don't have any other allergies at all? Are you not? Is it okay? Okay. So now we will be putting the perineal pad with an up-down motion as needed to prevent contamination of the vagina and urethra from anal area. So as you can see, this is only an improvised perineal pad. Okay, Ma'am Justine, are you comfortable enough to use perineal pad? I see. I will be discarding this in the receptacle. I will be placing it now, ma'am, okay? Exposing this one just a little bit, up, down, motion, then secure. So after this one, I will be helping the patient to provide the best comfort by placing again the top sheet. Ma'am Justine, can you please turn back to your side for me? Go back to your side, ma'am, turn. And no, ma'am, to my side, ma'am, I'm sorry. Oh, your ring fell, ma'am. Is this yours?
Yes.
Go back here, go back here. Then go back there, ma'am. Medical hamper. Then can you flex your knees for me a little while? Okay. Medical hamper also. Now you can rest your feet, ma'am. Are you comfortable? Do you want to drink water or not? Okay. So now we will be doing aftercare of the materials that I have used. Remove and discard gloves and perform hand hygiene after to prevent again the spread of microorganisms. I will be displacing this one here. We will be doing aftercare of the equipment. To the receptacle. And lastly, perform hand washing. Okay, finally, we'll be recording the treatment done to patients and any unusual findings such as redness, excoriation, skin breakdown, discharge or drainage, and any localized areas of tenderness. This is for documentation process, and the procedure was done, and of course a way and means of communication. Okay, Ma'am Justine. Hello, Ma'am Justine. I would like to inform you that the assessment up is done. It's finally done. I want to ask, how's your experience so far? It's nice to hear, ma'am. And thank you again. Do you have any other questions? I see. And I think that's it. Thank you again for watching, Ma'am Dal. I hope you're doing really good today. And again, my name is Kenneth Velasquez, your student nurse from Davao Doctors College. Thank you so much for watching.